ask you a question, Dr. Nuako, and maybe it has nothing to do with weight loss and stuff, but it gotta have something to do with stomach and stuff. Acid reflux. I have heard that people they have acid reflux. First of all, it's uncomfortable. It's all kinds of things, and people get surgery. I don't know whether this is the type of treatment besides of weight loss you actually do. So tell me first, does acid reflux, a person who has it, is that some type of sign of overweight, or if it's fixed that things get better, or that what does a person with acid reflux risk to have if he doesn't fix it?
Yeah, acid reflux on a chronic basis, on a regular basis, if you have it very frequently, is a risk factor for esophageal cancer. And I think this is April right now, which is the Esophageal Cancer Awareness Month. So it's important at any time that if you have reflux more than 3 times a week, that you get treatment, that you take something. If you've had reflux for a long time, especially men, if you've had it for several years, you need to have a scope to make sure that you do not have precancerous changes in the esophagus, which can lead to esophageal cancer. This is the fastest growing cancer in the gut right now. We see a lot. I see a lot of this esophageal cancer. They come and they can't say, "Oh, I'm having difficulty swallowing. My food is sticking." We go down and they've got cancer in the esophagus, and that is usually the result of reflux. So reflux is dangerous if it goes on for a long time, beside being uncomfortable for a short time. Yes, if you are overweight, there's pressure on the abdomen and it lets things come up easier. So being overweight does predispose you to reflux, and being overweight does predispose you to to esophageal cancer too. So if you have reflux on a regular basis, you should think about taking medication. When you buy the medication over the counter, it'll say do not take for more than 14 days without seeing a physician. And so ideally, you may want to see a physician if you do require to take it long term and discuss what the risks and benefits of these medications are. There have been a lot of things online and in the media about the side effects of these acid reducing medications. So we've had patients who have stopped who should really be taking them. So if you have any questions, go see your doctor and discuss whether you should be taking medication or not for your reflux.
And is that an expertise you have also? So people can come and see you for that also, right? You do know.
Yes, I'll be happy to see anybody who has questions about this.
All right. Is it true that acid reflux actually is not that the body, the stomach, has too much acid, but too little?
No, that's not true. The stomach acid may be standard. It doesn't mean you've got too much or too little necessarily. But acid is supposed to digest your food and then go down. But when it comes up, that is the reflux. So you can have reflux, and it need not necessarily be acid. It could be bile, B-I-L-E, bile reflux, or just water reflux. So you can have reflux that is not acid. But when it's acid reflux, it means that gastric or the stomach acid is coming up. So when you take the medication, it may prevent acid reflux, but it may not necessarily prevent reflux. So reflux just means material from your stomach is coming up into your esophagus and causing discomfort.
Does it also, if it's not acid reflux, does it also cause the cancer risk?
There is a belief that the contents of the stomach juice by themselves do increase that risk. So it's not necessarily purely acid, but some of the enzymes and some of the bile that's in there that causes that cancer risk, yes.
Makes sense. Thank you very much.
You're welcome. Thanks.